an opportunity to provide brief comments either by telephone or via Zoom from the 5th floor conference room of the municipal office building. I will now call the meeting of the Public Works and Safety Standing Committee to order, and I would ask the clerk, please call roll.
Roll call. Henry? She's online. Give her just a second. Roll call for Henry.
Here.
Thank you. Lopez? Burns?
Here.
Stites? We have an absence memo. Kane?
Here.
Burrows?
Here.
Commissioner Bynum?
Here.
Thank you.
Thank you, Madam Clerk. Thank you, committee. I will now ask the clerk if there's any revisions to the agenda this evening.
Yes, Mr. Chair, there is a revision to the agenda. We have a new item number 1, which was added, and it's a resolution regarding the automatic mutual aid agreement for fire and other emergencies.
Thank you, Madam Clerk. Committee, we have 5 items this evening that require action. So we'll start our meeting this evening with the approval of the minutes from December 12th, 2022, before we get into the 5 requirements for the agenda.
Commissioner Burrows,
Yes, Commissioner Hill.
maybe I just didn't hear it. I didn't hear my name. Or am I not supposed to be here? I'm just checking. Am I supposed to be, did you call my name or me?
I did not. You're on the Administration and Human Services Committee.
So I'm on the wrong, I'm in the,
You're fine. This is Public Works. You'll be on the
Okay.
next one.
okay, all right, thank you.
You're welcome to sit up here with us as we conduct business on the Public Works. It's easier for staff to have everyone seated, but you won't have a vote on this until we come to full commission.
Okay, perfect, thank you.
Great question. No, thank you. Our first order of business is approval of the minutes from our December 12th, 2022 meeting. And before I request a proposal, Madam Clerk, a few of us were not on the December 12th, 2022 meeting per se. Have the minutes been included in the documents presented this evening?
Yes, they were included in the agenda packet.
Wonderful, great. At that, I would entertain a motion for the approval of the minutes.
So moved.
We have a motion and a second. Second. I second that. Thank you. We have a motion and a second for approval of the December 12th, 2022 minutes. Clerk, please call roll.
Roll call. Henry?
Aye.
Lopez?
Aye.
Burns?
Aye.
Bynum?
Aye.
Kane? Commissioner Kane?
Aye.
Burrows?
Aye. Thank you, committee. That was a stretcher for a minute, but we got through it. Thank you. Committee, our first item this evening is a resolution. It's an automatic mutual aid agreement for fire and other emergencies. And the fire department is seeking the approval of a resolution authorizing the automatic mutual aid agreement between the Kansas City, Kansas, Edwardsville, and Bonner Springs Fire Departments to provide fire and emergency services to all of the unified government. At this time, we see staff moving forward. I would recognize our chief, Dennis Rubin, for comment.
Thanks, Commissioner, and to all the commissioners, we appreciate the opportunity to explain our recommendation tonight and hope that you do approve it. If you go back a ways, in 1966, the United States Fire Service got together in a forum to develop a strategic plan. I happen to have a copy of that very important document. And item 12 describes the fact that fire departments should engage in activities like we are, automatic aid and mutual aid. For quite a while, our fire department has enjoyed mutual aid. And what that essentially means is we get fire apparatus or ambulances or chief cars, one location, and then the decision is made to call for help. Automatic aid takes it a step further. With the technology that we have available, we can determine the closest fire department resource, whether it's medical, hazardous materials, rescue, or fire response, and get that vehicle or collection of vehicles rolling. What this does is allow us to have a boundary drop when it comes to operations and in the most efficient and effective way, be able to serve our communities along with supporting both Edwardsville and Bonner Springs. Fire departments over the years have not supported what I shared with you out of the Wing Spread Conference of 1966. But September 11th, 2001 changed that dramatically forever. New York City Fire Department is the second largest fire department in the world, certainly the largest in the United States, one of the best trained and one of the best functioning departments. That day, as you might guess, and for the next several months, they were brought to their knees. Although they have about 1,300 additional calls per day, every day, their entire fire department was at ground zero. What that meant is the mutual aid companies from surrounding states such as Connecticut, Maryland, Pennsylvania, and the like had to take care of business, if you will, for the New York City Fire Department. With this agreement, again, it strengthens our position. It allows us to serve our community better. The really good news, ma'am and sirs, is that it comes at no additional cost. All costs associated with our responding into their communities are covered by us. Their response into our communities are covered by them, by the two other cities. With that said, again, we would ask for your approval and we're ready for questions. I brought along with us today our Assistant Fire Chief that takes care of communications and automation, Sean McLaughlin, and of course, our attorney, Missy Bishop, is with us as well, if there's any legal questions.
Thank you, Chief. Any questions from the members? Any comments, Commissioner Burns?
Yes, I'm assuming that our good friends in Edwardsville and Bonner are on board with this.
Sir, they've signed their documents and we are the third component, if you will. If you approve tonight and Thursday night, this will go into effect February 1st. But both governments have signed through their legislative bodies, sir.
Thank you.
Any other questions or comments?
Kane, move for approval. Henry, second.
We do have a motion and a second, and thank you for that. We do have a point of order from Alan Howes, our legal counsel on committee. Alan, please.
I only play a lawyer on TV, not a lawyer by training, but I just want to make sure that the fast track is in the motion, since that was a request to this.
Move for approval, fast track to Thursday night's meeting.
Okay.
Henry, second.
Okay, great. Thank you. We do have a motion for approval of the resolution and to fast track it to Thursday's meeting. Okay. Clerk, I'll ask if there's any comments received from the public.
No comments received.
Thank you. I'll ask if anyone online wishes to make a comment. You have 3 minutes. If no one is appearing in person who would like to make comment, let the record show no one stepped forward. Thank you. We do have a motion. I would ask the clerk, please call roll.
Roll call. Henry,
Aye.
Lopez,
Aye.
Burns,
Aye.
Bynum,
Aye.
Kane,
Aye.
Burrows.
Aye.
Motion carries.
Thank you. Committee, entire communities benefit from this mutual aid agreement. Chief, thank you for bringing it forward. And please let the other chiefs know that we sincerely appreciate the concerted effort.
Absolutely will, and want to thank our team. They have been amazing, and especially a lot of extra work done by our law department.
Thank you. Okay. Our next bit of business this evening is a consent decree required projects. And I do know that we have individuals from Public Works here. The first item on our agenda is approval of a resolution authorizing survey and eminent domain for 8 projects. There is a request to fast track this item to the January 25th, 2024 full commission meeting. Also, I will recognize Troy Shaw and Sarah Schaefer standing in tonight for the Public Works Director.
Thank you, Troy Shaw, County Engineer. This is first item we'll talk about is the consent decree required projects is how we bundled it. So it's multiple projects that are required under our sanitary sewer consent decree. Majority of these are I guess all of them related to sewer separations in that project. And this is basically just the resolution so that we can move forward with the projects that have already been approved, get to a point where we can build them. So this is, as Commissioner Burrows noted, the resolution that allows us to go after right away and easements as necessary for the projects.
Okay, and any questions from the committee? Clerk, do we have any members of the public wish to speak to this item? Okay,
No hands were raised, no comments received.
thank you. Is there anybody appearing in person who would like to speak to this or address this item? Let the record show no one step forward. Any other questions from the committee? Seeing none, I'd entertain a motion.
So move.
Second.
Kane, second.
We have a motion and a second. I'd ask clerk, please call roll.
Roll call, Henry,
Aye.
Lopez,
Aye.
Burns,
Aye.
Bynum,
Aye.
Kane,
Aye.
Burrows,
Aye.
motion carries.
Great, thank you, committee. That moves us to item number 3. It's a resolution, again, stormwater program projects. The second item on our agenda is approval of the resolution authorizing survey and eminent domain for 6 projects. This is a request again to fast track this item to January 25th, 2024, full commission meeting. Again, I would recognize Troy Shaw and Sarah Schaefer.
Shaw County Engineer. Same thing as the last one. This is for a separate group of projects that are part of the WIFIA program and ARPA. There's a couple, I think, an ARPA project as well. So this is the same thing, moving forward for projects that have already been approved in the budget and we have sitting there. It's just need the authority to start negotiating for right of way and any easements necessary.
Committee, any questions? Anybody online with questions, Madam Clerk?
Bynum's got her hand raised.
Okay, thank you. It's Commissioner Bynum.
Thank you, Chair. Just wanted to ask Troy to maybe share with new commissioners and the public what WIFIA means. It's a financing tool to get some of this needed work done.
I'll let Sarah Schaefer take that one. She's the expert at that and is the one that helped us get these funds. So.
Troy, Sarah Schaefer, Public Works. So the WIFIA is a Water Infrastructure Act for financing. It's through the EPA and it is a loan program that assists communities in very low interest, long-term loans with their stormwater and their clean water projects done, which are stormwater and our CSO projects qualify.
Yes, thank you for that. And Commissioner Bynum, thanks for bringing that forward. It is an opportunity to fund the projects at lower interest rate at a longer term. So it's definitely beneficial to us when we have these projects of great magnitude. So I do appreciate that question. Anybody present would care to speak to this item? Let the record show nobody step forward. I would entertain a motion for approval.
So move.
We need an inclusion for
Second.
fast track.
Okay. The motion needs to include the fast track.
Yes.
Okay. Madam Clerk, do you get that? The motion does include approval as well as fast tracking the meeting mentioned.
Kane, second.
We have a motion and a second. Clerk, please call roll.
Roll call, Henry,
Aye.
Lopez,
Aye.
Burns,
Aye.
Bynum,
Aye.
Kane,
Aye.
Burrows,
Aye.
motion carries. Mr. Chair, if we could go back to the resolution on the consent decree. I don't believe the language was included to fast track that one.
I believe it did.
It-
It did. There was motion was made to include the fast tracking to the commission meeting. But thank you for that clarification. Next item, committee is another resolution. It's item number 4, Armourdale Proctor and Gamble Trailhead. The item on our agenda is the approval of a resolution authorizing survey and eminent domain related to the Proctor and Gamble Trailhead project. Again, I will recognize Troy Shaw and Sarah Schaefer.
So same thing on this one. This just happens to be coincidentally, it showed up at the same time as other ones. This is a typical project we have. So we received a grant for this trailhead project as well as $450,000 donated by Procter and Gamble for this as well. So what we're talking about, a trailhead is basically, this is right by the levee. So the levee trail that runs through there, a trailhead is a place for cars to go park. There's amenities such as benches. Procter Gamble providing some of the money. Part of that covers artwork and other amenities of the area, shelters, and things like that. So this is just to keep moving forward with the project to get easements and right of way as necessary.
Great. Any questions from the committee?
Is this fast track too?
This one does not need to be
Ah,
fast tracked.
I'll ask if clerk, if there are any comments received from the public.
No hands are raised, no comments received.
Thank you. Anybody present would care to speak to this item? Let the record show no one stepped forward. I would entertain a motion.
So move.
We have a motion and a second, and this does not include the fast track language. So clerk, please call roll.
Roll call, Henry,
Aye.
Lopez,
Aye.
Burns.
Aye.
Bynum,
Aye.
Kane,
Aye.
Burrows,
Aye.
motion carries.
Great. Thank you, committee. Our final item this evening is another resolution dealing with yet another trailhead for James Street. The last item on our agenda is the approval of a resolution authorizing survey and eminent domain related to the James Street trailhead. Again, I will recognize Troy Shaw and Sarah Schaefer.
Thank you. This should be quick. It's basically the same as the other one. We received a grant to do a trailhead off of James Street down by the water treatment plant or wastewater treatment plant. So same thing, looking for approval to start working on right of way and easements as necessary.
Committee, any questions? Clerk, any comments from the public?
No hands are raised, no comments received.
See no hands raised on the thing. Anybody present care to speak to this item? Let the record show no one stepped forward. Again, I would now entertain a motion, and this does not include fast track.
So move.
Second. Okay, so we have a motion and a second. Clerk, please call roll.
Roll call, Henry,
Aye.
Lopez,
Aye.
Burns.
Aye.
Bynum,
Aye.
Kane,
Aye.
Burrows,
Aye.
motion carries.
Thank you, committee. Those were the only 5 action items needed this evening. The Public Works, this portion of this evening's meetings will be concluded. The Public Works and Safety portion of this meeting is adjourned, but I need a motion to adjourn. So I would entertain a motion for adjournment.
I'd make a motion to adjourn.
Second.
Okay, we have a motion and a second for adjournment. Clerk, please call roll.
Roll call, Henry,
Aye.
Lopez,
Aye.
Burns.
Aye.
Bynum,
Aye.
Kane,
Aye.
Burrows. Motion carries.
Everyone.
I would like to say that Mr. Kane's a lot better looking on that side over there.
Oh, this live, brother.
Clerk, please call roll.
This is Commissioner Bynum. We'll let the Administration and Human Services Committee get situated and we'll start the next meeting. And clerk, if you would let me know when folks are ready.
I will. Commissioner Bynum, I believe we're all in place.
Excellent. Thank you so much. We will go ahead and get our Administration and Human Services Standing Committee meeting underway here. Welcome to everyone who's there in person, and I'm sorry that I wasn't able to join you there in person for our first meeting of the year. Before I call the meeting to order, I do want to announce that some committee members, staff, and public are attending remotely by Zoom as well as on site. And we are asking all participants joining by phone to mute your phones when you're not speaking. During the meeting, make sure you announce yourself by name and title when you speak so that the public observing knows who's speaking, and make sure you speak directly into a microphone so that we can collect all comments and have a good record of the meeting. It's critical given the number of remote participants, and it's also current guidance from our Kansas Attorney General. The public is allowed to participate by Zoom or submit comments by email prior to the meeting, and those are included in the record of the meeting. The public can also indicate intent to provide remote public comment by contacting our clerk's office by 5 p.m. the Thursday prior to the meeting. The public will also have an opportunity to provide brief comments either by phone or Zoom or from the fifth floor conference room of the municipal office building. I will now call our meeting of Administration and Human Services Standing Committee to order and ask the clerk to please call the roll.
Roll call. Hill,
Here.
Davis, we have an absence memo. Ramirez,
Here.
Kane,
Here.
Bynum.
Here. Clerk, do we have revisions for our meeting tonight?
Yes, we do have one revision to the meeting. Item number 3, which was the resolution for the automatic mutual aid agreement, was moved to the Public Works Committee. So it was removed from this one.
Okay, thanks very much.
Uh-huh.
First order of business tonight is approval of minutes from December. And I believe that during the last meeting, we did cover that we can approve minutes even for those of us who may not have been present for that meeting. Is that correct?
This is Z Bishop, Unified Government Legal Counsel. Yes, Commissioner, that is correct.
We have a motion for approval, please, of minutes from December 20. Wow, this is December 2022. Sorry about that.
Move for approval. Kane, second.
Thank you very much. We have a motion and a second. Roll call, please.
Roll call. Hill,
Aye.
Ramirez,
Aye.
Kane,
Aye.
Bynum.
Aye.
Motion carries.
Thanks very much. Our first item out of 2 is approval of the Human Resources Guide update. And I will recognize Ms. Shakiva Christian, Manager in Human Resources. It looks like you have some staff there with you to make the presentation.
Yes, I do. Thank you, Commissioner. Shakiva Christian, Human Resources Manager. I have with me staff members in Human Resources, Anna Howarth, who is our Benefits Administrator, and Courtney Sagen, our Senior HR Partner. We have one small change regarding our retiree health insurance benefits and the health insurance policy as a whole. So staff will go ahead and make those comments.
Anna Haworth, and the first revision that we're going to discuss is that due to Workday in 2022, we have now updated our policy to reflect the Workday advancements having to do with Human Resources is proposing that our current healthcare benefits policy that allows organization to streamline the overall benefits process for our active and retired employees. Implementation of Workday in the ERP system has changed the method of processing and administering our benefits program. So the benefit election and changes, current policy addresses employees' paper notification process for new hires, open enrollment, and qualifying event changes. Introducing Workday in 2022 allows us to the notification process to be the responsibility of the employee. Like new hires can elect for benefits within Workday, open enrollment processes are completed in Workday, and then qualifying events and processes are also now completed in Workday. And when we're addressing retirees, previously policy guidelines, employees eligible for a full retirement were not eligible to obtain retiree health benefits if they regain UG employment and were eligible for UG sponsored benefits. All billing was manually inputted at that point. Now that Workday is fully live, we have proposed policy changes which address employees eligible for a full retirement will be eligible to obtain UG sponsored benefits if they return to our organization. In a position that are eligible for benefits, they will be eligible to re-enroll in UG retiree health insurance if they meet the qualifying criteria. And Workday payroll does not have the capability to categorize the active employees paying the retiree rates. All I have.
So that's the gist of the changes to the HR guide. Any questions regarding that particular policy?
It sounds like, this is Commissioner Bynum, it sounds like some of what you've done is to align with the automation, basically, of the new Workday system. Would that be correct?
Shakiva Christian, HR manager. Yes, that is correct, Commissioner. The policy or the systems have required us to change our processes, but we also find it a benefit that retirees, or it wouldn't disincentivize retirees to come back and work for unified government by allowing them to return to that retiree program once they leave employment again.
Thank you. Are there questions from members of the committee?
Commissioner Kane, move for approval.
Commissioner Bynum, Commissioner
Yes.
Ramirez has a question.
Okay, Commissioner Kane, just hold that for one moment. Commissioner Ramirez.
I will second Commissioner Kane's motion, but just a comment. I remember when we were going through the Workday, the presentations and trying to the planning process for us to get Workday. And I remember, I do not remember what year it was, a presentation of processes of the HR department and how paper-based it was at the time. And not just HR, but all departments across our government, how much paper-based they are. And so I think now with Workday, we're starting to change that. And I'm happy that we're making those changes in our human resources department so that we can be more efficient, so that we can take care of our employees better. So thank you. And I do second Commissioner Kane's motion.
Excellent, thank you. Any other questions from our committee? Okay. And clerk, anyone online asking to make a comment?
No hands are raised.
And is there anyone there in person who wants to speak on the item?
No one is approaching the podium.
Excellent, thank you so much. We do have a motion and a second, so call roll, please.
Roll call, Hill,
Aye.
Ramirez,
Aye.
Kane,
Aye.
Bynum,
Aye.
motion carries.
Thank you very much. And thank you to our HR staff for the work that you've done to bring it forward. It is most appreciated. Next item is approving the submission of a National Association of County and City Health Officials grant to address vaccine hesitancy. And I believe we have Wesley McCain, Policy and Development Manager in our Health Department, coming forward. And Wes, if you would introduce the person that's with you. And the floor is yours.
Thank you. Thank you, Commissioner Bynum. Wesley McCain, here with Elizabeth Gronweg, our Chief Epi, and Dr. Eli Caldwell, our Public Health Director. We submitted a grant to the National Association of City and County Health Officials for vaccination. I assisted with the grant, but the lion's share of the work was done by our Chief Epidemiologist, Elizabeth. So she has a short presentation about the vaccination status of our county and the grant that she's going to give. And I'll pass it over to her.
All right. Thank you so much for the intro, Wes. So I'm going to be sharing a bit about this grant that we have applied for. And we were supposed to present on it in December when we submitted the application, but the date got pushed back a bit. And so we are sharing that we also were offered the grant and I'll talk a bit more about the timeline on that as well. Okay, so I wanted to start a bit about the reason why we applied for this grant and some of the concerns that we have in Wyandotte County to better understand why this funding is so important for the work at the health department. So the problem really is low immunization rates in Wyandotte County, specifically our childhood immunization rates that children should receive before attending school. Unfortunately, post-COVID across the country and in Wyandotte County, we're seeing that childhood vaccination rates have decreased. And this is a concern that's been brought up by some of our school district officials as well. They're seeing children continuing to fall behind with their immunizations before they enter kindergarten, and really failing to keep up with those immunizations as they progress through school. And so why is that important? Obviously, one of the most critical functions of a public health department is preventing the spread of infectious diseases. And so low immunization rates in our community really leave us vulnerable to a lot of different vaccine preventable diseases, everything from more mild things to very severe and life-threatening illnesses. Some of these vaccine preventable diseases include measles, mumps, chickenpox, whooping cough or pertussis, and even some life-threatening illnesses like bacterial meningitis. And so this grant will help to bolster our efforts in the community to make sure that we're doing everything we can to protect our community and our children from these vaccine preventable diseases. I pulled some data. This is secondary data that I got from the state health department. They do an assessment every year of vaccination rates across the school districts in Wyandotte County. And here we have the data for our four school districts in Wyandotte County. So you can see, well, maybe not, there's like a little black box there. Okay, that's gone now. So for USD 500, our biggest school district, this data in the first column is looking at the percent of kindergartners that have all of their required vaccines for last school year. At the bottom there, you see those list of required vaccinations per Kansas law: diphtheria, tetanus, pertussis, polio, measles, mumps, rubella, varicella, hepatitis A and B. There are other vaccines that are recommended, but these are the ones that are required by state law. And so for USD 500, 81% of kindergartners entered with all those required vaccines. Piper, 73.3%, Bonner Springs, 91%, and Turner, 86%. And so when we were doing our research for this grant, we really noticed that there was kind of a split among the school districts. And so for our focus on this grant, we're really focusing on KCK and Piper because they do have the lowest vaccination rates. Also, we look at religious exemption rate data. So parents can choose to not vaccinate their children for religious or philosophical reasons. And those numbers are, higher than we'd like, but not terribly high, showing that there's something else that we're missing here, some other reason for why parents are choosing to not vaccinate their kids. And at this point in time, the health department doesn't understand what that reason is. And so part of this grant is doing an assessment to really understand these reasons and these complex issues for why parents choose to not vaccinate their kids, and those numbers continue to fall. I wanted to share as well what the data looks like in Wyandotte County for some of those vaccine preventable diseases. So this shows in the last 5 years, the number of cases of various vaccine preventable diseases that we've had in our county. Wanted to highlight whooping cough specifically, or pertussis. It's a very uncomfortable, very serious illness, especially in young children and babies. And we did have a pertussis outbreak in Wyandotte County in the last 5 years. I also wanted to highlight chickenpox, which is, for I think everyone in this room, wasn't always a vaccine preventable disease, and a lot of us suffered through chickenpox. But that's no longer needed because there's a vaccine that's very effective for it. And it really helps to stop outbreaks of chickenpox in our schools. We also did have a case of bacterial meningitis and tetanus in Wyandotte County, both very serious and life-threatening illnesses that are preventable through vaccination. So I wanted to talk a bit about the vaccine hesitancy grant specifically. It's awarded through the National Association of County and City Health Officials, and it's titled Equipping Local Health Departments to Address Vaccine Hesitancy. This grant selected 3 local health departments to receive up to $100,000 to address vaccine hesitancy in their community. And as I mentioned before, we applied for this grant back in December, and we're planning on bringing it to the committee sooner, but that got postponed. And so we did receive notice late in December that we were one of the counties selected to receive this grant. And so today I'm just looking for approval for us to move forward with this grant opportunity. What we would do with that funding is outlined here. So we really want to work with our school districts to better understand why parents are hesitant to vaccinate their kids, what the barriers or concerns are, and how we can work to address that as a health department. We know that this is a really complex issue, and so part of this grant is doing an assessment, listening to parents, listening to community members to really understand what's going on. We would also be forming a vaccine hesitancy task force with some of the other healthcare providers in Wyandotte County, some of our safety net clinics like Vibrant and Swope, and the school districts to continue to dialogue about this issue. And then the overall goals of the grant are to better understand vaccine hesitancy in Wyandotte County and to develop a comprehensive plan on how we can address this so that the problem doesn't continue to get worse. So that's all I had for today. Again, we are looking for acceptance, approval of this grant since we have been awarded it. And Wes, did you have anything else to add?
Just that I don't think we put on the agenda, but we were asking that this be fast tracked to the January 25th meeting. We were originally planning on coming in December, but those got postponed until this month. And so we found out in the meantime that we were awarded this grant, which is great, but the sooner that we can get accepted, the better. So
Commissioner Kane moved for approval with fast tracking to Thursday's meeting.
Second, Ramirez.
All right, thank you very much. And thank you to the health department for continually looking for ways to expand what we're able to do with grant dollars. It's really appreciated, and welcome again to our new health department director. I wish I were there in person to greet you. Questions from our committee before we vote?
I do have a question, Commissioner Bynum. This is Hill.
Yes,
And my question is, I saw you were going to approach the school district and other avenues, but since a lot of the kids you are going to, you're trying to get information about is kindergarten or before kindergarten, is there a plan to get into homes to those parents, those young parents in particular with these babies?
Yeah, that's actually a really good question. At this point in time, we haven't made any specific plans for, approaching that pre-K kind of parent population, but I think it's something that we can definitely work into the grant. Our strategy initially, at least, is to work with the school districts because they have identified already students that are behind in their vaccinations that we can, have focus groups and surveys and forums with. But I guess one of my assumptions would be that if a parent has older children that are behind on vaccinations, it's probably very likely that the pre-K and younger kids are also behind on their vaccinations. But when we form this task force, we can also explore options for reaching out to parents of kiddos that aren't in school yet.
Okay, thank you.
Any other questions? Clerk, is there anyone online that wants to speak?
No hands are raised and no comments were received.
And anyone there in person asking to address it?
No one is stepping to the podium.
All right, excellent. And we do have a motion and a second that includes a fast track to Thursday night. Roll call, please.
Roll call. Hill.
Aye.
Ramirez.
Aye.
Kane.
Aye.
Bynum.
Aye.
Motion carries.
All right, that concludes our meeting this evening. Thank you to the health department. Really appreciate your work. Our meeting is concluded for the evening, and I would entertain a motion to adjourn.
Move to adjourn.
Second.
All right, we have a motion and a second. Roll call, please.
Roll call. Hill.
Aye.
Ramirez,
Aye.
Kane,
Aye.
Bynum.
Aye.
Thank you. And I need to confirm that second.
For the,
Kane, either one, Kane or Hill.
yeah,
Thank you.
thank you very much. And Administration and Human Services meeting is adjourned. Thank you all. Have a good night.
It's PWS. It was heard on PWS. That was the blue sheet that came out Friday.